my situation was probably not usual. I was born into a family of physicians. My father had a partner, and they had a clinic that was attached to our house. So when I wanted to see my dad, I would walk to the clinic. And so I was introduced to medicine early on. I saw the wonderful aspects of it. I saw his patients, brought him food, chickens. He took care of a family that actually bartered with gold discs that they had got. They melt down x-rays and make gold discs, and that's what they paid him with. So then I was the baby of the family. So my sister, my brother-in-law, her husband were doctors. My three brothers were doctors. And they all seemed to be having fun and having a pretty good life. I thought it would be a pretty good thing to do. Well, my practice now is different than what I did. I was an orthopedic surgeon for 22 years. I did surgery on everything. Now I don't do surgery. So the most rewarding thing is to see patients who don't need surgery and be able to help them with conservative management of their problems, whether it's an acute problem from an injury or whether it's a chronic degenerative process, they're going to put up with me for years. And to help those people get well and getting them back to being functional, not having pain, and being able to do the things they need to do day to day is what's the most gratifying for me. When I see patients, I spend a lot of time telling them what's wrong, reviewing their x-rays, their MRI scans, the CAT scans. Then I examine them and I tell them what's wrong. And I try to get them to understand a little bit about anatomy and why they're sick, why they're hurt, and helping them understand and having a program so they can get well and move on with their life, whether it's going to be a short-term fix or forever. And at the end of the day, I want them to look at me and say, what is my diagnosis and what is our plan to make me better? And if they do that, then I know they're interested, and I'm happy to tell them and explain everything to them. So that's what I want them to ask me. Well, the first thing they always want to know and want to ask me is, where's that accent from? Because I was born and raised in Texas. And the other thing, I love working in the yard. I love going places with my family and my dog. And then I'll have a lot of fun riding motorcycles. They probably wouldn't believe that because people think motorcycles are going to hurt you. And I've been fortunate. I've been riding since I was about 13 years old, and I really enjoy it. I'm Dr. Robert Ranelle. My mission at Jefferson is to improve lives.